My advice for people that are going to be doing this or implementing this or potentially looking at implementing this procedure into their practice, I think go into it with an open mind and with a thought that your position in that team of providers and healthcare professionals that are working with this patient, that you are a very important piece to that puzzle. And by asking these questions, you are diving deeper into that patient care than what maybe the medical provider is safe or comfortable or knowledgeable of. So you are providing a huge piece of that puzzle.
Now, at the end of the day, you just have to make a commitment to doing it, right? And you make that commitment because it is what works, right? For too long, we've let people who have problems with addictions or problems with mental health be those people, right? And that's why we're in the mess we're in, right? So make a commitment to it, do it, familiarize yourself and your staff with what SBIRT is, and choose how you're going to implement it, right? For the grant-funded program, it's really, really effective to prove the concept via the in-house specialist model that we have now. Because like I said, it's very low risk financially, and you have people that are trained specifically in how to talk to people with substance use and mental health problems. But that will spread, right? Once you have the right people that know how to communicate with other providers, that's the key. Patience in when you implement a new program, it doesn't fix itself overnight, and that you have to have individuals buy in and be committed to what you're doing and the reason and the rationale why you're doing it. I think that's a big hurdle, is to make everyone realize the purpose of it, and then see the response later on. Be patient to see the response later on down the line.
There's going to be a lot of changes. Whatever system you immediately establish, there's going to be a lot of changes. Be open to making those changes and network and communicating both within your area of responsibility and outside of it. That's a huge thing when it comes to MAs and providers, as well as talking to other organizations outside of what you do.
But each agency is going to be different because of whatever system they're using. We happen to use the EHS system, and I highly recommend typing up checklist to where it flows, and then you share it with your people, with the MAs, and the MAs run the providers. The providers are kind of, they're there, but the MAs are the ones that really run them. So it's important to type up checklist that they can just run through and know what they're doing. And so I highly recommend that. Get those checklists going.
Be patient with it. When you first start, it's a mess. You're adding all this new stuff to your workload, and it's not flowing right. But I think once people do get the flow of it, it gets easier, and it's just part of their everyday. You don't even have to think about it. It's just part of your workflow.
Just be patient with your patient. I always do my SBIRT last. I go in and do everything else, so they're comfortable, with me. Like, I do like a little small chit chat if I know that the SBIRT's coming, and then I just gradually slip some of these questions in. And then when I say, okay, well, I do have a couple follow-up questions to ask you, if they refuse, then they refuse. But sometimes I don't get that many anymore. I've noticed, since I've changed my, I guess you can call it, strategy on how I ask them, I have a better result that way.
I think the thing that helped me the most was, if you are new and they're already established in your location, to observe as many different people as you can. Just check out their style, try it out yourself, see what works for you. You can be really flexible in the way you deliver it, and even in different locations, I have different ways I deliver.
You have to be aware of what your limits and boundaries are. In other words, like what are the kinds of things you need to, that you have the capacity to address in-house, and then what are the kinds of things you need to refer out, you know, because oftentimes, not oftentimes, but at times, we'll get people that are more severely mentally ill than what we're capable of treating here, and so we have to make a referral. And so you can't be everything to everyone. And you might do interventions, you might work with a person for a few sessions and then realize that they need something more than what you're giving them. And so having the flexibility to be able to do that. And then the patience to be able to let things play out. And what I mean by that is that the provider, you know, or the SBIRT process might refer someone to you. However, their willingness to engage with that might not be there yet. And so, you know, communicating with the provider is like, well, yeah, they do have these issues, but, you know, they're more at a, you know, contemplation stage of change, and so they have to, you have to be, you know, willing to wait for them to be ready.
You're going to make mistakes, and that's okay. I mean, there's a lot of stuff that goes on, and especially with the documentation. And so, like we were talking earlier, we have errors, and you fix them, you move on, and you learn from them. The best thing you can do is kind of learn from it, and ongoing learning, especially with the tapes and stuff like that with motivational interviewing, is super helpful, getting that. And you see that throughout the time, you see that in your brief intervention where you can actually get more out of people by, you know, actually using certain tools that, you know, are best for you, because not everybody is going to use the same questions or, you know, use the same verbiage as somebody else, but they might get the same good result. So
I try to get a feel for the environment. Is it tense in there? Is she going to be apprehensive with me talking to her? I introduce myself and usually just take it from there. If they're not giving me much feedback, I try not to pressure them into anything. If they don't want to talk to me, I understand. But most of the time it just takes them a little bit and they open up.
Well, being new myself, I'd say the best advice is to not get too scared, because it does take time. It's really overwhelming at first, or the initial, you know, getting in there and talking to people for the first time. But don't get scared, because you do learn and you do become comfortable. You need to practice and learn from experience.
Because a lot of times I'm seeing someone for their toe, I'm seeing someone for their rash, and the next thing you know, it's all this, you know. So it can really waylay you. I think the biggest part in being in this job, not just with the SBIRT, but working with other departments and working in this environment, is trying to be a lot more flexible.
So if your mission is to help patients, and SBIRT has shown to do that, then making that argument from, hey, I'd like to implement SBIRT, and you're saying, why would I do that? Well, because it helps patients, right? And it's relatively easy to do, and it makes sense.
Just be yourself and be serious, but have fun with it, and just, you know, just care for people. I mean, it's kill them with kindness. I guess I've had times where people are rude to me. Don't be afraid of that, because it's just one person, and you'll get through that. You'll get through anything, so.